Board round, session number 17. The moment you step foot on campus as a medical student, you are gearing up for one of the biggest tests you'll ever have to take. USMLE Step 1 or COMLEX Level 1. The medical school headquarters and BoardVitals are going to help you prepare for your first board exam with questions, pearls of information, and guidance to make sure you have what it takes to score high and match into your specialty of choice. Welcome to Board Rounds. I hope you're having a great week. I want to thank you for taking some time to join me today. My name is Dr. Ryan Gray, your host here every week, as well as the host of many other podcasts at mededmedia.com. This week, we have a good pediatric question with Dr. Karen Shackelford. Karen, welcome back for some more Board Rounds. How are you today?
Good, Ryan. So today, this question is not a tropical medicine question, more or less a pediatric illness that we have a 10-year-old male patient who's evaluated for abdominal pain. He's had for 2 days, and it's kind of diffuse abdominal pain. He's got a rash on his buttocks and thighs, and it appeared about 3 days ago. He's also complaining of some pain in his ankles and knees. His past medical history is unremarkable, but he was seen in clinic 2 weeks ago with symptoms of an upper respiratory infection. On physical exam, his abdomen is tender to palpation, but no peritoneal signs, no rebound or guarding. He has multiple palpable purpuric lesions on his buttocks and upper thighs with some petechia. His ankle is swollen and tender on the right. There's no warmth or erythema. His knee is tender, but otherwise, his exam is unremarkable. And his laboratory studies show a normal CBC, but on urine dipstick, he has microhematuria. So what is the most likely diagnosis?
Oh, all right. What are our answer choices?
Okay. IgA vasculitis, which was formerly Henoch-Schönlein purpura, hemolytic uremic syndrome, Kawasaki disease, or acute post-streptococcal glomerulonephritis.
Oh. So this is a hard one. If a student, and I don't remember these all specifically, but a student who may not know potentially right away, like, oh, I know that one, right? All of these answer choices are kind of like, well, that fits this part and that fits this one. And so this is one of those answers or questions where you're like, no, why did you have to give me answer choices that could potentially fit different symptoms? So that makes it really hard when you forget what all of these are. And so, IgA vasculitis, you mentioned, Kawasaki's acute glomerulonephritis, post-streptococcal, acute glomerulonephritis, and then hemolytic uremic syndrome. That was the other one you mentioned?
Right. Yes. Uh-huh.
Oh, man. So the rash. So if I remember correctly, oh man, I don't remember these. Kawasaki has a rash, I believe. It's interesting because I'm like, well, acute glomerulonephritis. I'm like, why would that cause a rash? So post-streptococcal acute glomerulonephritis. So I'm like, oh, maybe that one doesn't really fit. So I might throw that one out right away without kind of knowing anything else. Again, hemolytic uremic syndrome. Again, I'm like, well, does it have a rash? Like, I'm going to throw that one out too, just because I forget. And so I'm left with the vasculitis or Kawasaki's, and I'm going to go with the IgA vasculitis because it just seems like potentially it fits, but that's just trying to use my old knowledge and whittle it down. But let's hear some explanations in the answer from you.
Well, you're pretty good. That's what it was.
Oh, wow.
So, yeah, I think the thing to remember about, and they are, if you're not doing pediatrics, it is hard to remember the differences in some of these cases. But, okay, so the palpable purpura on the buttocks and lower extremities is one of the criteria that you have to have for Henoch-Schönlein purpura. and without thrombocytopenia. And then the other symptoms that this patient has, you can have one or all of these other symptoms, which include like polyarthralgia, usually in the hip, ankle, and or knee joints. GI symptoms that include abdominal pain, nausea, vomiting, you can have ileus or intussusception, renal involvement, and without thrombocytopenia or coagulopathy. Those are the two big things. So the stem mentioned his CBC was normal, and he did have apparently the proliferative glomerulonephritis, which occurs with IgA deposition in the glomeruli, and that is also characteristic. So Heinrich-Schönlein purpura or IgA vasculitis is leukocytoclastic vasculitis that is kind of characterized by leukocytes and monocytes, or neutrophils and monocytes are around the small vessels, the arterioles and venules. And there's IgA deposition. There can be IgG, there can be IgM. There is complement C3 deposition. And so if you're going to look at a biopsy, that's basically what you would see. And the lesions are generally in the GI tract or in the skin. Those are typically the ones that are biopsied. But if the patient does develop the glomerulonephritis, then renal biopsy obviously shows that. That doesn't develop in every case. The disorder is self-limited, so treatment's supportive. And that's pretty much it. It's an immune complex thing that occurs usually after an upper respiratory infection. So it has been associated from time to time with, in one case series with the MMR vaccine, but I don't believe that held up in later studies. So primarily the evidence of an upper respiratory infection. Also the age group. It's common between the ages of 3 and 11, although one of the diagnostic kind of criteria, I guess, is that the patient has to be under 20 for this diagnosis. So,
interesting.
Yeah.
Okay. And then can we go through the other answer choices, why they maybe were potentially a valid choice for parts of it, but in the end weren't the right answer?
Sure. So hemolytic uremic syndrome, actually, you mentioned that it probably doesn't have a rash. You can have petechiae purpura with that. And although I believe they're non-palpable, and they are palpable in Heinrich-Schönlein purpura. So that's kind of a clue. But that occurs in hemolytic uremic syndrome due to thrombocytopenia. And this patient has a normal CBC. And again, hemolytic uremic syndrome is usually associated with E. coli infection in the previous case of diarrhea. So that E. coli 57 E. coli infection. So that there's no history of that. Unexplained bruises. I don't think there's any abdominal pain in particular. And again, I apologize. There is abdominal pain, but the rash is not limited to the lower extremities and buttocks. I mean, that's for some reason characteristic of HSP, IgA vasculitis. Okay. Oh, so the next one was Kawasaki disease. Usually occurs in children under the age of 4. The cases that are presented will usually present with a child of Asian descent. I think Japanese is associated with or more prevalent in Japanese children who are at high risk of IVIG resistance. So they generally will have conjunctivitis and a fever for more than 5 days, and it's characterized by that strawberry tongue, which is almost invariably mentioned in a test question about Kawasaki. The skin manifestations are non-palpable purpura. Again, non-palpable. There's periungual desquamation and hand and foot erythema. That is usually mentioned as well. That's kind of characteristic. Yeah.
All right. And I think there was one more there.
One more. Let's see what was acute post-streptococcal glomerulonephritis. Yep. So that can present with hematuria, obviously, and since it can occur after a skin infection, right, or a pharyngeal infection, so that probably was meant to be throw them off with a rash, or maybe somebody will consider this because there's a rash involved. It's group A beta hemolytic strep. This patient had a previous upper respiratory infection, which could potentially have been caused by strep, but arthralgia isn't common, abdominal pain isn't common, and the purpura also are not associated with acute post-streptococcal glomerulonephritis. So those are the answer choices.
All right, there you have it. I think I'm starting to get lucky on these. In case you didn't know, I don't know what these questions are before Karen and I jump on Skype. She just asks them, and I try to stumble my way through the question. So hopefully with my rambling and trying to figure out these questions, it will help you with your thought process as well. I got this one right today. I think I got it right for the wrong reasons, but I still got it right. And that's all we care about on the board exam. Let's just get them right so we can get a good score and get the specialty we want. If you are looking for a QBank for your board prep, look no further than BoardVitals. With their amazing QBank of over 1,700 questions for step 1, over 1,500 questions for level 1, with detailed explanations and rationales behind every question, every answer, why it's right, why it's wrong, you will have the preparation you need to succeed on your board exam. Again, go to boardvitals.com, use the promo code BOARDROUNDS. It's all capital letters, BOARDROUNDS, to save 15% off any of their packages. Have a great week. We'll see you next time here on Board Rounds.